Have you ever heard of a victory garden before? During World War II, the national food system was under a serious strain. Farms were focused on feeding soldiers overseas, transportation resources were limited, and many foods were rationed. Grocery stores alone could not feed everybody, so communities were encouraged to grow their own food. And people actually did it. Families planted food in their backyards, schools created gardens for their students, and churches used their open land. Entire neighborhoods turned vacant lots into shared growing spaces. By 1944, more than 20 million victory gardens existed across the United States, producing close to 40% of the vegetables Americans were eating at the time. Think about that for a minute. Nearly half of the country's vegetables were being grown by everyday people like you and me. Families had consistent access to fresh vegetables during a national crisis, nutrition improved, household food costs decreased, communities worked together instead of competing for limited resources. And during this incredibly stressful time, people gained a sense of stability and control. Today, we will recognize this as community-led public health. Here's a part of history that often gets left out. Many Black families, growing food was not something that was started during wartime. It was already necessary because segregation had already limited access to resources and many neighborhoods lacked reliable food sources. So because systems were not built equally, African American families often relied on gardening, farming, knowledge passed down through generations to feed their households. Let's fast forward to today. We still see communities without many grocery stores, surrounded by fast food and unhealthy options. You'll see higher rates of hypertension, diabetes, and heart disease in neighborhoods where fresh food is hard to get. And that tells us something important. Health outcomes are not only about personal choices, they are shaped by the environment, access, and opportunity. Victory gardens remind us that health does not begin in the hospitals, it starts right in our communities. When people have access to land, knowledge, and resources, they improve health outcomes long before medical care becomes necessary. And this is why modern community gardens and urban agriculture programs matter so much today. They are continuing the same principle of communities supporting their own health when larger systems fall short. Sometimes improving public health starts with something as simple and powerful as growing food right where you live. You have a community garden in your neighborhood? Let me know in the comments and I will tag my local favorites.